right, so we should be live on LinkedIn now. We're live on Facebook. We're live on YouTube. We're live on Twitter, Twitch, Daily Motion. I'm just going to check that we're good on Instagram as well. All right, we're good on Instagram as well. Okay. All right. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lawrence Doan, and tonight we're joined by Dr. Amanda Phoon Nguyen. She is a Perth Oral Medicine Specialist, PhD candidate, Adjunct Senior Lecturer at UWA, and consultant at Perth Children's Hospital. She is passionate about oral medicine, and her professional role includes co-chair of the Australasian Sleep Association Dental Sleep Medicine Council, and on the board of studies in oral medicine, editor and examiner of RACDS, and is the treasurer of ADA WA. She's secretary of RACDS WA, vice president of the Dental Specialist Society of WA, treasurer of the IADR Perth region, and so many other more committees. She represents her specialty at several multidisciplinary meetings. Dr. Amanda Phoon Nguyen, welcome to the show.
Thank you for having me.
So today we're doing a MUKBANG special, #Burning Mouth special. So for all of our listeners, I apologize in advance again if there's too much noise in the background from either my runny nose, coughing, slurping when we're having the noodles. So yes, as Amanda's pointed out, she's holding up the volcano ramen that she's specifically requested for. I'm going to forewarn everyone, I don't have a strong chili stomach, so if you're hearing this, you probably won't see it, but first up, I've got the Shin ramen, so that's how I'm going to sequence it, and then I've got this volcano ramen following up after that. Now, to see how it goes, I've got the water and I've got the milk on the side. So I understand Amanda's mentioned that, no milk allowed, but we'll see how we go, hey?
No sugar, Coke Zero, and I just have the one ramen, the spicy one.
So, okay, we'll get straight into it. So the last time you were on the DHS podcast, which is Dental Head Start podcast, it was COVID-19 2020. Since then, there's been some more information about it. How's the ADA WA been contemplating tackling this issue as they watch their New South Wales or East Coast counterparts going through this period of time?
So I think probably the important thing to note is that ADA WA, we don't actually set the rules. So the rules are actually set by the Chief Health Officer. So we don't have the power to tell people what levels that they have to be at, which I'm not sure if a lot of people realize. So it's not actually up. The ADA did come up with the guidelines for the service restriction, but we don't actually tell people what level it is. That comes from much higher up. Now, what ADA WA is doing, and our CEO David Hallett's doing a fantastic job. We advocate for what levels we think we should be at. If we think that it's unreasonable, then we sort of talk to the Chief Health Officer and let them know. We provide member support during that time. A lot of people have a lot of questions. So I think short answer, we are keeping abreast of what is happening. If we think that it's unfair or unreasonable, then we represent members and take it higher up. But as everyone's realizing, COVID-19 is, it feels weird to call it 19 now, but COVID-19 is such a rapidly evolving situation. I think there's a lot of moving parts. So I think we just have to take it as it comes. I mean, I'm pretty sure the Delta strain is going to come over west at some point. I don't think we can prevent that. And I think it's just trying to get our pieces in a row. So hopefully when that happens, we can minimize the impact.
Fair enough. What's your take on the future of the dental industry in terms of how we'll learn to deal with COVID as part of our everyday life? People are talking about rapid antigen testing. People are talking about frequent workplace screening, infection control changing a little bit more frequently. What's your take on that?
I really don't know, to be honest. I think nobody will know. One of the things that's really good is that the ADA federally have actually come up with the new infection control guidelines, which should be hitting everyone's emails today or tomorrow, or maybe even yesterday. So I think just keep abreast of that. The good thing is that there are a lot of people who are much more learned in this than I am, and they're putting all their heads together and doing all of these policies and documents. So I think there has to be a degree of patience from people. Like, I do understand, like, it's so frustrating. You know, we get all of these guidelines, like, where do I get hydrogen peroxide mouthwash? Like, I don't want to, like, there's no more peroxide, we can't buy anymore. Or like, do I need to buy an evacuator? Like, I understand, and it's very anxiety inducing, but also everyone's learning as they go. So I think probably in the short answer, the really good start is to try to read and keep abreast of the current infection control guidelines. You can't get any more up to date than the one that was just released recently. And see where we go from there. I don't know if there will be massive big impacts, because, you know, dental clinics already have very good infection control anyway. But I think it's basically having some flexibility in keeping up with what's happening, and a bit of understanding it that everyone's just doing the best they can as well.
Yeah, that's fair enough. You actually did a TED talk, didn't you, on teleconference at one point? How do you think about, because that was fairly recent. Tell us about what your thoughts on that now.
Way of the future. I think one of the things that COVID-19 has given us is the opportunity to actually explore all of these things. Like, I think there wouldn't be as many webinars, you know, telehealth conferences, not just in dental, like medical as well, without COVID-19, really. So in a really roundabout way, like, we've always known that we need to reduce the barrier to health, to try and get, you know, people who are in remote and regional areas better access to the healthcare system. I think telehealth is the way to do that. Dentistry has always been a little bit of a challenge, because how much can you actually do of dentistry if you cannot touch the patient? But then you'll be surprised that there are actually things that are happening that are becoming more and more accessible as technology improves. So, classic example, you know, your dental maxillofacial radiologists who report on imaging, they don't necessarily have to see the patient face to face. And I think there will be some developments along those lines where we will make it slightly easier for patients to access us.
So let's talk about your CPD journey so far. So before specializing, you're a general dentist, and at one point in the Navy. What's your CPD journey up to that point?
I always liked CPD. Oh, it's a bit spicy, huh? I'm not quite good at spice, but I think I took a big chunk of chili. I've always liked CPD because I am quite like a social person. So CPD to me, besides the learning, it was also a really good way to network and get to know people and, like, you know, and socialize. So I think I've always liked attending CPD courses. The webinars, to be honest, wasn't something that I was really big on until COVID-19. Podcasts I started to get into a little bit because I would do quite a lot of driving for work, and I would, you know, tune in and listen in. But yeah, basically I started attending a whole range of different CPDs. If there was anything that caught my interest, I would try to attend it. I did make some mistakes early on in my career by attending some courses that I wasn't ready for. So I think very early on, I paid, you know, 5 figures to attend an implant course. And, you know, in hindsight, like, it wasn't right for me. I've placed one implant in my life, and I was like, okay, no, not for me. I mean, clearly, because I'm oral medicine now. But I think my CPD journey was at the start, and I think probably a lot of dentists will sort of feel this as well at the start, was that you want to do as much as possible. And then, like, with the benefit of hindsight, you start to realize, like, what are the things that you probably should do first. So I think things that improve your bread and butter dentistry is always better at the start. As you get better and as you have more experience, then, you know, you move on to the so-called, like, more advanced courses.
Yeah, so what kind of bread and butter dentistry courses did you find helpful?
Yep. So a big one that I think now most people should do is actually communications. Because one of the things that I was actually thinking is that it doesn't get taught a whole lot in the university. And we know that communication will really make or break an interaction with a patient. Like, if you can't communicate, or if you don't know how to put your point across in the best way, That's really where I think we can get into trouble as a dentist, because the patient hasn't understood what you said and you think that you've communicated perfectly. So I think communications is really important. Treatment planning as well, really important, because that's the basis of what we do. Like, it makes no sense to place an implant in a patient straight away if you haven't considered the rest of their dentition. Radiology is a big one. I think it is so important for dentists to know how to interpret images that they're taking themselves, just from the, you guys know I'm on social media a lot. So sometimes I see a lot of people post like, oh, what is this? What is that? Like, it'll be better to attend a course to actually know, because the other thing as well is it's not 100% reliable to ask for opinions like this. Like, that's not really the way it should be done either.
When you're in the Navy, did that help you? Like, did they help you sponsor or accommodate for some of those courses? Were you doing implants when you were in the Navy, and that's why you decided to pick it, or?
No, so the Navy are very good at helping out with CPD courses. So they do pay for you to attend CPD courses that will be relevant. Now, in the Navy, as a general dentist, you will do a lot of general dentistry. So I didn't do any implants, that will usually be referred out to the specialists. But I think that the things that I attended as part of the Navy would be things like, your ADA congresses and stuff like that. Like, they will pay for you to attend, because that will all be, relevant for you in the services. Because when you're in the Navy, so for people that are not aware, there are specialists in the Navy as well. And then if anybody in the military needs specialist care, they get referred out. So I think there's a focus at the start, because I joined the dentist as a very new grad. So at the start is really, their focus is getting those basics and those foundations, right? And then the CPD course would be, and the CPD courses that are appropriate for that.
Right. So then you did the MRACDS. That's a little bit different to what the primaries are to get into the fellowship. I've heard about it through a few other colleagues. I had it from a colleague back in Adelaide from Alan Mann, and I heard it from one of my mentors, Chris Hadwicki. So tell us about how that led you to finding your love for oral medicine specialty.
So when I was in dentistry, didn't want to specialize. I think people who know me will know that. And then I graduated, I worked as a dentist, and then I realized that I wanted to do a little bit more, because as I said, I did like attending all of these CPD courses. So I obviously, most people know what the primary, so I looked into pathways at the through the colleges. And at that time, the MRACDS program was something that was fairly new. What the MRACDS program encompasses is a 2 or 3 year program where you answer short answer questions throughout the year. You present some cases at the end, and then you have a viva. You get assigned a mentor, and you have to do a certain amount of CPD hours. I think it's like 200 hours or something like that. So it all kind of ticked my boxes, because at that time, I was new to Perth, didn't really know anybody. The thought of having a mentor to guide me through was very attractive. I was doing a lot of CPD anyway, so I thought, well, I might as well try and work towards something. So that's when I got started on the MRACDS program. Now, during university, as I already said, like, I didn't want to specialize. I wasn't a particularly great student, actually. But then I realized when I was doing the MRACDS program that when it was something that I was trying to do off my own back, I actually found it really interesting. And one of the cases that I presented at the end was a oral medicine case. Yeah, and then I started to ask around a little bit more. I got to know a couple of oral medicine specialists in Perth. I shadowed one of them, Ramesh Balasubramaniam. I don't know if you know him, but I ended up following him around and working in the oral medicine clinic, just observing for 6 months before I started oral med. And then the more I found out about oral med, the more I liked it. So yeah, the rest is history.
Oh, fair enough. So now that you're an oral medicine specialist, where to from here? How do you upskill? How do you maintain on top of the latest knowledge?
Very important, because nobody at any stage of their career, I think, will ever know everything. I think I actually learn a lot. So I do get invited. I'm very fortunate to be invited to lecture quite a few at a few different places, and I love lecturing. Preparing for the lectures actually really gives me a really good drive to keep on top of the latest knowledge, because when you are teaching something, you have to know it before you teach it. So that's personally how I like doing it. And then also being part of, your specialty associations like the European Association of Oral Medicine, and obviously there's an Australian one as well. Attending those conferences, hanging out with specialist colleagues, getting involved in research. Like, I think all of that is fairly important. And before I started oral medicine, Professor Michael McCullough, actually, who's in Melbourne, he was telling me his story about how he just fell in love with oral medicine. He never looked back, and all he thinks about is oral medicine. And to be fair, with all the oral medicine specialists that I know, it is very similar. Because I think once you like something so much and you get asked these questions and you see patients with these relevant conditions, there is an actual drive to go and read up and find out, or even research it, because you're interested in it and you want to know more. So I think practically preparing for lectures, teaching students, all of this sort of stuff forces me to keep on top of it. Doing my social media posts as well. I do research and check everything properly before I post it, because I don't want to put out wrong information. So, all of that keeps your knowledge base up to scratch. And then also, attending conferences, learning from other senior colleagues and things like that.
Fair enough.
Yeah.
So, has there been a particular CPD that's had the biggest impact on you in terms of oral medicine wise?
Yeah. There was the World Workshop in Oral Medicine, and it was in Gothenburg, Switzerland. Sorry. The spice is clearly getting to me.
I'm here with you, man. I'm here with you. We're going through this.
Sweden or Switzerland? Anyway, it's in Gothenburg. So it was really good. There's a bunch of us that went over. They tied on with the European Association of Oral Medicine, big oral medicine conferences, all of these big names, very exciting, because these are the people that you read in textbooks, and they've written papers, and you get to meet them, and they shake your hand, and then you gush about their paper, and then, they come off a little bit weird, but they get it. So, like that oral medicine conference was fantastic. I mean, obviously, it wouldn't be of interest to anyone, I think. I don't think it would be of huge interest to anyone who wasn't in oral medicine. But as an oral medicine registrar at the time, it was a lot of fun, and a lot of it was a social aspect as well.
Interesting. So, maybe in the future we might bring it here as well. Hey, at one point.
Oh yeah, like I'm pretty sure. Well, I don't think I can say that publicly, but I think it has been considered.
So, there's not a lot of oral medicine CPD, as we've just mentioned, for the general dentist. But how would you suggest the general dentists get better in educating themselves on oral medicine? I think you mentioned, how when you were getting into it, you're kind of shadowing specialists. But is there any other avenues you would recommend?
Yeah, so I think there are CPD courses. I mean, I suppose comparatively, compared to other things, there's not a lot. Some of it is a reflection as well on what people want. So I feel, obviously bias party, I feel like there's a lot of oral medicine courses, because I feel like a lot of us lecture, a lot of the time. Like in Sydney, I'm pretty sure Su Ching Yo, she just did the MRONJ webinar for ADA. I think Anastasia did one for the ADA New South Wales. Like there are always oral medicine courses, but it reflects on what people want. So if you are interested in a particular course, for example, an oral medicine course, you want to learn more, pay for the course and attend the course, because organizers of the courses, I am on the WA Dental CPD committee, so I know that there are a lot of WA oral medicine courses. But if people aren't attending these courses, organizers don't tend to run them as much. So maybe oral medicine is not as exciting, it's not as sexy as oral maxillofacial surgery. You pull out the tooth and it's bloody and stuff, and people are like, ooh, like it's not like that. But I think if you are keen on oral medicine, like just attend those courses, pay for those courses, and tell your friends to attend them, because I think organizers will run events if there is demand for it. And yeah, so hopefully the landscape is changing now that oral medicine is something that people are becoming more interested in, and then hopefully they will want to attend more courses.
Yeah. Well, I never would have associated pulling out teeth looking as sexy. Maybe if you're doing more cosmetic stuff, maybe.
I don't know. I do follow a few, oral maxillofacial surgeons, some prosthodontists, some dentists on Instagram, and I always laugh because they make it look so good. I think there's one oral maxillofacial surgeon. I think he's a weightlifter as well, and it's just really funny. I can see the appeal, right? Because obviously it's like a lot more interesting sometimes to actually look at a successful surgery, because the result is right there, as opposed to me posting up like drug interactions, which can be a little bit dry sometimes. But I think this place for everything.
Yeah.
Hopefully more people like oral medicine now.
I hope so too. You know, I was laughing because I actually know who you're referring to, but for all the other listeners out, they'll have to go find out themselves. So, who has been your biggest mentors or idols or inspirations in your career path, and why?
There are actually a lot. So I think I don't know if people feel like they only have one. I am of the belief that you should have a few, and it all differs at different time points, right? So when I was going to university, it could be a lecturer that you really admire, and when you first come out in practice, it could be someone that you work with. I mean, for me, I got to know Dr. Libby Day, Dr. Albert Tan through doing the MRACDS program. They're wonderful, lovely people, like both very learned, excellent at dentistry. Albert's a periodontist, Libby's a very, very good general dentist. So both academically and socially, like they're wonderful people. Like they own a little farm in Chittering. They invite me up all the time, to eat beef. Sorry, that came off wrong, but you know what we do. She does make a very good roast beef, which I eat. So I think mentors are really helpful both in helping you come out of your shell, which that was a very big part of me when I first came. Because I think today I was just looking on DPR and there's someone that posted something, and they were talking about how do I find out about what's going on in the dental industry? Like I didn't even know anything about this TGA stuff until I saw this online. And, I think sometimes you have to get out there and meet people as well, talk to people. I mean, the obvious answer is also to join the biased, but the obvious answer is also to join the ADA because that's such an easy way to do it, to keep up to date with everything. But you can have, so to get back to the mentor question, you have to get to know people and then find worthy mentors from there. And then you don't have to like everything about your mentor. You don't have to agree with everything with your mentor, but they have to have certain aspects that you admire and that you do want to emulate. And so for me, I've already told you about Albert and Libby through the MRACDS program. Ramesh, you've heard about me talk to him about his, he was really someone who was so supportive of my interest in oral medicine, which I really appreciated. And then, I have no doubt that there will be a lot more as my career grows. David Hallett at the CEO of ADA WA, Jenny Ball, who's director of WA Dental CPD, like they all have aspects that I really admire about them. We don't always agree on everything, like with anyone, but it has to be an evolving process. And I think the other thing as well is that it's also a two-way street, right? Because I myself have been a mentor in the MRACDS program. Sometimes someone's not ready, like they don't really want to, like they don't really need a mentor at that stage in their career, and that's fine. And then you just have to be there for them and then come back another time. So it's a very fluid process. So I think sometimes when students, they're about to graduate, they all know that they want a mentor, but they don't know what it means. Like, do they want someone watching you as you do a rotary endo? Or do you want someone to call when you've got tough cases? Like, I think it has to be quite clear as well. And I think that relationship has to be understood from both parties as well. So if you are putting someone in a mentor type position, it's good that they recognize and acknowledge that so they can guide you along too.
Yeah, I guess it's one of those things. I mean, shout out to the ADA because I'm actually in the mentoring program as well, and I definitely find it very helpful during early in my career as well. But to your point, I think what it comes down to is that communication. You just got to be clear. If you find that they're checking you too much, just tell them that's probably not what you're after, and that a little bit of, if I have that issue, I'll come to you and I'll find you. Whereas some people, like you said, they might not be getting it enough, and what the mentor might be offering was what they thought was enough from maybe a previous experience, and you just have to communicate that. It's kind of like, I guess, if you're dating someone, you just got to be open and communicating. Otherwise, you can't. No one's going to understand what the other person's thinking. Exactly.
Because sometimes I see mentorship relationships break down, but from the outside, it looks to me like it's because they didn't know what each other wanted.
Okay. So for some of the folks watching, I've finished the Shin Ramen. I'm moving on to the volcano one. I'm not looking forward to it, but here we are. We're approaching. How are you doing over there, Amanda? You're killing it. No dramas. And I don't think you've even touched the Coke yet, so I think you're doing pretty good.
I have not, but apparently they say soft drink makes it worse, so we'll see. I'll tell you.
So, have there been any particular struggles you've had in your CPD journey or dental journey so far that some of the viewers might not know about?
So for my CPD journey, just for myself, implants was something that I was really not interested in. But I let myself be talked into it fairly early on in my career. And then I paid for the course and I did it. But like, I was right. it wasn't something that I had interest in. So I do regret it a little bit. I mean, I think it was a little bit of a waste of money, to be honest. Like, it's just not something that I had an interest in or that I would do. But other than that, by far and large, all of the CPD courses I really enjoyed. Like even the ones that are a little bit out of left field. So for ADA WA, we had a course that was called It's All About the Spine. And it was given by a physiotherapist, and he was like talking about like, you know, because they just have a lot of neck and back issues and things like that. Really enjoyed that one. There was another talk. There was another CPD course on work-life balance. Also really enjoyed that. So I think with CPD, I feel that if you attend a course that you are interested in, that you will never regret it. It's only if you let yourself get talked into attending a course that you kind of deep down know that you didn't really have an interest in, that you would regret it. Everything else, actually, to be honest, I really liked. Haven't done as many overseas courses as I would have liked because, you know, just my life in general. Like I was in the Navy and then I owned a practice and then I specialized. So I didn't really get to do a whole lot overseas, which I regret. Like I wish I did, but you know, COVID. So
yeah, little COVID. So yeah, interesting point you mentioned there about owning the practice. You know, practice ownership you've mentioned in the past was a challenging period in your time. You know. And since then, you've kind of embraced CPD leadership, CPD training, haven't you?
Yeah.
Tell us a little bit about that.
Yeah. I mean, for me, I felt that leadership would be the leadership courses that I attended, like the Certificate of Advanced Dental Leadership, couple of communications course. I attended those courses because of the committee roles that I was having, and I wanted to do I wanted to do better. Like I wanted to know what it's about because I didn't have a lot of training in it to begin with. Also, I did a little bit through the Navy because Navy, as a dentist, when you join the Navy, you're an officer and then you're expected to lead as well. And I just wanted to know what I was doing. But I never really had any aspirations to go back to owning a dental practice. I think there have been a couple of people. I think Sahil has actually come out to say that he used to own a practice, didn't like it either. I think sometimes there's a bit of pressure from yourself or from external people when you think like you're going to graduate, you're going to own your own practice, and that seems to be like the goal. Perfectly normal and perfectly okay if that's not for you. Because again, I was fairly naive at the start, and I opened up a dental practice in partnership with a business partner. That went horribly south, and you know I just realized it's just not for me. Like paying the bills, worrying about payroll, HR, staffing, like that just not. That like all I want to do is my dentistry and my oral medicine. So I think that's okay. Like I think that's okay. There should be no shame in saying that like you don't actually want to own a practice. I'm not sure many people feel that, but definitely I felt that when I finished. Also, again, generalizing, so apologies if I offend anyone, but like from an Asian background, I think there's also a little bit of that pressure that like, you know, you're going to finish, you're going to own your practice and you're going to like do all of this stuff. But I'm really happy where I am now, and like selling my practice was the best thing I've ever done.
It's an interesting point you take. I guess for our career, there's no real ladder, you know, to take, is there? Like compared to some of the other professions that we might see, you know, there's a progression in roles from, you know, intern to manager to executive and all that. I guess for the dentists, it's more like an associate, and then it's just like senior, maybe dentist, and it's, I mean, then that's where people get that confusion. And I pause because that's where people get confused as to seeing how their career path kind of, you know, goes, and then so if they think to themselves, oh, if it's not going to be practice ownership, then I'm going to have to specialize because that's the only other way to further my career. And it's that tricky space where a lot of us associates or dentists kind of get caught in. Do you feel?
Yeah, I think so. Like, to be honest, and I don't know the numbers on this, so don't come for me. Like, I'm not a business person. I've already said it. That's why I sold my practice. But it seems to me like an associate dentist can make a very comfortable living, be very successful, and they don't have to have the stress and headaches with owning a practice. I think even if you own one practice, you may not necessarily make much. I think if you're doing it for if you want to do like excellent financially, I think it's owning the multiple practices. But then that gives you so much headaches, and you're not in competition with anyone else, right? It's just what you want to do for yourself. Because that's the thing with specialty as well. Because I often have like people introduce themselves to me and they're like, oh, I'm just a general dentist. Like there's actually no such thing. Like I've said that before. Like a good general dentist is an incredibly hard job. Like the reason why I specialized is because general dentistry was too much for me. I didn't want to know so much about everything. Like it was too overwhelming. I wanted to know a lot about one little thing and focus in my happy little world. So I think there's this sort of ladder that you describe, like, new grad, associate dentist, specialist or practice owner. Like, I don't think that that's true. So many associate dentists are incredibly successful, and, everyone's successful in their own field and their own way. I think it's just a recognition of what works for you. So for me, I know that if I were to own multiple dental practices, like I would not, like I would just quit. I couldn't do it. But there's so many people that do a really good job about it. So I think it's finding your strengths and weaknesses, understanding yourself really well as well. And I think it is a very common trap, obviously, because we all know people who ended up owning their own practice because they thought that it would be the way for them, because that's what they've been told, that would be the next ladder, the next progression, and it's not really that way. I don't think. Yeah.
So you mentioned, struggles with the specialty. Can you talk about any other particular difficulties you might have? I might detour a little bit off from what you might talk about, but I know that breaking bad news is definitely difficult for a lot of recent graduates.
It's difficult for everyone. It really is. I routinely have to give life-changing news to patients, but so do dentists, and telling people that their teeth need to come out. That's really bad news. Like telling people that their front teeth need to come out or they need a full clearance and stuff like that. Like, I think that all can be really tricky, and there are definitely a lot of courses and papers around that can help as well. But I think the easiest and simplest advice that I can give for that is to make sure that you're not rushed. Make sure that you've got the appropriate time and setting, and then talk to the patient how you think you would want to be spoken to. If you are getting cues from the patient that they're getting distressed or upset or overwhelmed, then you can adjust your tone and the message that you're giving to your patient. And then if it feels like the patient's not receptive or they don't understand, bring them back another time, tell them to bring someone with them. So I think it is confronting. But it is something that there are definite, guidelines and goalposts, and there are definitely things that you can do that you can put in place that will make your life easier.
You're putting me up to the challenge. I'm like, I don't know if people can see this. I've got so much chili on my mouth right now, but I'm holding off on all the chili. On all the water and the milk because I don't want to bail out now. But it's okay, If I do bail, don't judge me. Don't judge me.
Do you eat spicy food normally?
No. As hot as it gets for me, it's probably like sriracha is probably on my menu, but
Sriracha's like ketchup.
Guys, she's calling me out. She's calling me out here. So, have there been instances where there's been like a particular condition, that cannot be diagnosed immediately with the usual tests, like what we might see on medical conditions? And I'm just referring here, like shows on House, The Good Doctor. And if so, how do these conditions kind of come about, or how do you approach these kind of conditions? And do you work with other colleagues on these kind of cases?
All the time. All the time. If there's anyone that tells you that they never get a case that stumps them, they're absolutely lying. Happens all the time. The most important thing, don't rush. Don't feel the need to give the patient an answer straight away. When that happens, I'm super honest with patients, because the thing is that sometimes it's difficult to do when you're inexperienced because you don't want to come off as inexperienced. But the best thing to do is tell the patient that you don't actually know and tell them how you're going to find out. So it will either be like, I'm going to do a literature search, I'm going to talk to my other colleagues, we're going to go have a multidisciplinary meeting, and I will get back to you. Like, most patients are very reasonable and they won't expect you to have the answer straight away, especially if
It's got to, guys, it's got to.
Especially if it's something that they've seen multiple people about and you're the third or the fourth opinion. Like, if you go in there and go, oh yes, it's definitely this, unless you're really sure, like, like just take the time, tell the patient that you don't know. It is very acceptable for you to not know the answer, but tell them how you're going to fix it. It's the same advice that I give students in Vivas as well. Your final year exam, like, don't make it up. If you don't know it, tell the examiner and tell the examiner where you're going to look for the answer. So very similar. And absolutely, a lot of cases, well, not a lot, but quite a few cases are multidisciplinary. A lot of cases, if we're not sure, because I'm very lucky to work in a group oral medicine practice. One of the advantages about that is that there are 5 of us who work together, and then sometimes, every so often we actually meet up to discuss some of these cases. So yeah, no, absolutely. And if someone has a cancer diagnosis and they're being treated in the public hospital, it's all discussed in multidisciplinary settings as well. So you got, oral medicine, oral maxillofacial surgery, ENT, plastics, oncology, dietetics, cancer nurse, speech pathology. Like, we all discuss cases together. So I think multidisciplinary management is really the gold standard for some of these really difficult cases.
Yeah, that's reassuring to hear, to hear that from your perspective, even from a specialist perspective, Yeah. And that's, I guess, something that we have to apply in general dentistry as well. Don't rush into it if you don't feel comfortable or you're not sure of what it is exactly. It's okay to take a step back and then to do a further test or talk to someone to kind of get until you come to something that you're more comfortable with sharing.
One of the big ones that I do see, for example, is patients that are in a lot of pain. They see the dentist. The dentist can't really find anything wrong with the tooth, but like, oh look, and the patient is desperate, right? They're in pain, they're crying, painkillers don't touch it. They do an extirpation, and then it wasn't really the tooth to begin with. Like, that happens quite commonly, to be honest. And I do understand that we are helpers, right? That's why we do dentistry. We want to help people. But sometimes it's like taking a step back, admitting that you don't know what's causing the pain, but you don't think it's the tooth, and we just need to wait. So I think sometimes it's the experience and the confidence in saying things like that as well.
That's interesting. So I guess, have there been instances where there's been like the referring specialist or the specialist has given back a report that says, it's uneventful or benign, but the general dentist is adamant that there's something abnormal or there's questions otherwise and challenge maybe that diagnosis? And again, something I only see on House and The Good Doctor, so I'm only just asking. Yeah, I think so. I mean, don't have an example, but it definitely happens. Like, sometimes a general dentist will be like, could it be this? Or like sometimes we get, sometimes someone refers a patient in for me and they're like, they've got this strong pain, blah, blah, blah. I don't think it's a tooth. I think it's trigeminal neuralgia. And then I look at the patient and go, look, I don't think it's a tooth either, but I actually don't think it's trigeminal neuralgia. And then we just have a conversation. Because one of the things that I really encourage people to have is to actually have a really good relationship with their referrers. Because if my general dentist that my specialist, whoever, refers the patient into me and they call me up and go, look, are you sure it's not this? Because like I read this. And I'll be like, you know what, let me look into it. I'll read up a little bit, I'll get back to you. Like, I don't take it as an attack. Like, I think people are more than within their rights to actually discuss about the patient's care, because it's a mutual patient as well. So hopefully, in those cases, my whoever's will be comfortable enough with me to come and actually ask me like, are you sure it's actually this? Like, did you think about that? And I'll be like, yeah, I did think about that, but it doesn't quite fit because of this. I'll be like, you know what, that's a good point. I'm going to look into it more and bring the patient back. So I think that's probably the best way. And, like if this patient was your mom or your friend, like you would hope that your healthcare practitioners would have that sort of relationship. That's a good point. I guess pick up the phone.
Yeah, pretty much. And like most specialists, well, I'm generalizing, but like for me and a lot of specialists I know, like we're so accessible. Like, you can find me anywhere online, really.
So
I should be online so much, but yeah.
With so many different challenges that you've faced, that's never seemed to hold you back from pushing forward. How do you balance, the work-life balance that with so many different roles that you're doing simultaneously?
I suppose the most important thing is, well, 2 points. One of it is that, of course I get tired. Like sometimes I think like maybe I should have said no to that role. So I think it's important to acknowledge that at different points in time, you will feel differently about your different roles, right? That doesn't mean that you made a mistake or anything like that. Like if you consistently feel that way, then definitely like you need to change something. But it's normal to have off days. The other thing was that I think it depends on the person that's doing it. It depends on your personality. Because I had to think about it. A lot of these roles that I do, like I really like, and I think I'll miss them so much if I didn't do them anymore. I can't think of anything worse than being forced to do these roles. So I think if someone asks you and you say yes because you felt bad saying no, like then you can resent that job really, really, really quickly. But I think if it's something that you enjoy doing, then you do naturally end up making time for it. Another thing as well is that I don't have kids, so a lot of my friends have kids and their life seems really hectic. Actually, probably more hectic than mine. So I think that also probably helps me have a little bit of balance, that I don't have to factor kids into the equation. My husband's he plays video games, but he's fairly self-sufficient. He's not quite a kid, he can take care of himself. Yeah, so I think I think it just works because I want to do these things, so I make time for it.
You might not have kids, but you've got pets.
I do have pets. I'm very attached to my dogs. Yeah, but they're easy. You just take them for a walk every day, give them a little bit of food. Or sometimes I can even take them to meetings, depending on which meeting. Yeah. What was I going to say? I can't remember what I was going to say now.
It might come back to you in a moment, eh?
Yeah.
So, what's your current ideal clinical day look like? The type of things that you might be getting up to.
Oh. My ideal clinical day is a mystery clinical day. Because the best thing about oral medicine, right, is that you never know what's going to walk through your door. So I like having, I think I would like a good mix of new patients and review patients. New patients, because obviously that's what's keeping my practice going. Seeing new patients, finding out, new interesting cases. Or even if it's routine cases, just helping a patient out as well, giving them a diagnosis, quality of life, all of that sort of stuff. And then reviews I find quite rewarding as well, because then you get, over time you build a relationship with these patients. You see them, you guys, how's your golf game going? Or, how's the grandkids and stuff like that. So I like the relationships that I build with patients for my review patients. We do become quite friendly, obviously, because we see each other regularly. And then the new patients to keep things interesting. So I think for oral medicine, there's no really ideal day, because you just never really know what's going to walk through the door. But I think that's part of the attraction of oral medicine as well. Yeah, but yeah, basically I like it very varied. I like a little bit of everything.
I apologize for everyone that's watching, and I'm throwing different faces at Amanda. It's not that, okay? It's just the heat.
You know what? For someone that doesn't eat spice, I'm actually really impressed. You've done really well.
This is me now. I'm trying to hold the fort down, but when this is over, anything could happen. Anything could happen, hey? Tomorrow maybe might be a different story as well, hey? So I think most people don't realize. Nice job. So for everyone that's listening, Amanda's just finished her bowl and she's gunned it. No waters, nothing. She's keeping composure. There's a few coughs here and there. You probably heard it, but overall, she's done really well too. Hey.
It's really tasty though. Actually, that's the thing about these noodles. They get you because they're so spicy, but they're so tasty.
They're addictive. You just gotta keep going.
I know.
So, I think most people don't realize that oral medicine includes. Sorry. That oral medicine includes temporomandibular disorders, dental sleep medicine, radiographic lesions. Speaking from my own experience, I've made the assumption that I only send oral pathology to the oral medicine specialist, but that's not the case, So, and you've got a particular interest in pediatric oral medicine as well. Tell us a little bit about all of that.
Yeah. So I suppose the thing is, for me, like, I think it depends on where you are. So that's why, going back to the point of it's really important to get to know who you're referring to, is because you want to know if they see that sort of cases. So there's no, like, I don't think like oral medicine sees everything and you must send everything to us. Like, I'm not like that. So when I'm in Darwin, I actually work with an oral maxillofacial surgeon, Leon. He's a great guy, and we work really well together because we communicate and we know what cases each other sees. So if there's non-surgical management of TMD, like conservative treatment, he refers them to me. If they need TMD surgery, then obviously they'll be with him. If it's oral lichen planus and it needs ongoing management and review and corticosteroids and stuff like that, he will refer the patient to me. And then, if there's any sort of lesion, big lesions that needs to be biopsies, cysts in the jaw, stuff like that, refer it to him. So I think it's all about knowing who you're working with and knowing what their expertise is in. So I also work, like, I'm friends with a lot of oral maxillofacial surgeons. I'm friends with a lot of dental maxillofacial radiologists. Like, I don't, like, it's not a turf war. So if there are cases where I see someone and they've got a radiographic finding and I need their expertise and I need, like, additional imaging, if I need an MRI of their TM joints or I need CT of the mandible, I'm up, for example, to an oral medicine specialist wherever you are. And then they may go, oh, actually, I don't see those cases. Then, because you've spoken to them, then you refer them to someone else. So I think it's very much establishing the open lines of communications. Because, every day I get messages from my referrers, from my colleagues, from my friends, and they'd be like, I've got this one. It's a bit of a strange one. Like, will you see it? And I'll be like, no, it's an OMFS. Or I'll be like, yes, I'll see the patient. Or like, no, do a report, to get a DMFR report. So I think it's, I think it's all just communication, really. I don't get offended if people want to refer to someone else first. Like, as I said, like, I really don't think it's a turf war. It's all about treating the patient appropriately. And I think if you work with people that you can work well with and you understand what everyone's doing, like, there's not a lot of conflict in those areas. What was the other second part of the question? Pediatric oral medicine. So pediatric oral medicine. So I do work at the Perth Children's Hospital. Pediatric oral medicine. So actually, when I was thinking about specializing, the two things that I was considering was either oral medicine or pediatric dentistry. And then I realized that I really like oral medicine, and it made a lot more sense for me to do oral medicine and then think about seeing kids than the other way around, because I didn't really want to do like the stainless steel crowns and stuff. So pediatric oral medicine, it's just like adult oral medicine because kids get these conditions too. But then the presentation and the management obviously can be very different. So we do see, for example, TMD in kids. A lot of them, sometimes they've got syndromes like Ehlers Danlos, for example. And they can, sometimes have, idiopathic arthritis or, all of these sort of things. So it's like oral medicine, but in a weird way, it's also completely different because the management and the presentations are different. And plus, I like seeing kids because they're cute.
That's so awesome. I noticed that we're already pushed. I can't believe we're already over time. But I'll put one last question in. You do a lot of different social media platforms. You're on podcasts. Spoonful of oral medicine. There. You do IG posts. You do blogs. Where have you found your audience to be the most engagement in terms of content and in terms of the content that you talk about? You talk about leadership. You talk about social media. You got to talk about perceptions about dental careers. It's a whole wide range of things. What's been your biggest takeaway from those discussions?
Oh gosh, okay, big question. What I get the most engagement from, to be honest, I don't actually track engagements that much. Like, I know there are some people, no, I don't think in the dental industry, probably like in the influencer industry where they track like, they get like algorithms and they look at things and like I don't really look at that because this for me is like a hobby. Like if anybody wants to look at my posts, then then I would love them to, but I'm not like actively like counting followers. So I don't actively track engagement, but I think Instagram is biggest for worldwide because I think there are a lot of people obviously from other parts of the world where Instagram is more popular. Among my local colleagues, it seems to be Facebook that they're more on, and we have a chat there. And the biggest takeaway from everything that I'm doing, I think it sounds really cheesy. I know it does, but I think you've just got to do what makes you happy. Because with everyone that I talk to about CPD, advancing you in your career, all of that sort of stuff, the patient interactions, like it doesn't come if you're not happy and if you don't have work-life balance. And I think it's also important to be fairly open about that as well. I mean, I've spoken to a couple of people where they have decided that dentistry wasn't the right career for them, or they were unsure whether it was the correct pathway for them or not. And I think it's quite important, I think, to have that insight yourself and to have a little bit of a think as to, are you really doing what makes you happy? Because, life is short. We only have a finite time on earth. Like, if you worry about what people are going to say about you, if you're worried about whether you're going to disappoint your parents or not, like, it's a difficult way to live.
Dr. Amanda Phoon Nguyen, thank you. There's so many questions I wanted to ask you, but that's all the time we've got for today. Thank you for coming on the show today, and thanks for sharing on this mukbang burn your mouth special. I mean, like I said, you haven't touched your drinks at all. You're doing it. I'm trying to hold it down trying to keep it up with you. I've got the water, I've got the milk, and they're still kind of hanging in there.
You did very well. I'm very impressed for someone who does not eat spice. You did so well. Very impressed. I think apparently you milk now.
Yeah, I can feel my stomach. I feel it all happening right now. So if you can let the people know how they can find you and what's kind of going on in your life.
Yeah, so I am on Facebook. So I do have an oral medicine page called A Spoonful of Oral Medicine. I am on Instagram as well, oral medicine, oral pathology. Those are probably the easiest ways. But then if you Google, I also have YouTube and Twitter and my personal Instagram and Facebook. And if you're in Perth, hit me up. We can go for coffee. Like, you guys know where I am in Perth as well. Yeah.
Well, I hope you have a good night. I'm going to try and recover through all this. Thank you for your time.
Thank you. See you. Bye.
Bye.